And the nutrition, again, I can't say too much about it, but the optimal nutritional regimen as we prescribe it is not a diet, it's an intervention. It totally removes all forms of food that triggers inflammation and oxidative stress. And that's important when you're trying to heal the body. It makes a major impact in terms of patients being able to improve their health in a really short period of time. Hello, everyone, and welcome back to Montgomery Heart Wellness. And we have yet another clinical rounds at MHW. And, this is a very interesting case discussion. This is a gentleman who has a history of bypass surgery a number of years ago prior to coming and seeing us. He came to see us because he was having interesting symptoms of tightness around the neck. He saw us other cardiologists and was given some bad news, and he wanted to see us for some alternative care. So let me have Camille just fill us in on the details. Camille, what can you tell our team about this patient? I mean, let's start back from his history of the bypass surgery a number of years ago. What happened then?
So back then, at that time, he was around 50 years old. He had some fatigue and, typical cardiac symptoms that is what brought him to see a cardiologist in the first place. And they did an angiogram, found he had multivessel disease, and did an elective bypass. So he got 4 or 5 grafts, and he was told to eat a heart-healthy diet, be active, exercise after the cardiac rehabilitation, and he felt really good for most of those 10 years after the bypass.
He was pretty lean and buff, if I remember correctly, right?
Yeah, he would do pretty intense exercises, very fit. But then in the last year, he had got more fatigue and a very alarming symptom where he worded it that he felt there was rope on his neck and somebody was pulling it.
Oh,
like
wow.
a intense tightness, and that would be with exercise or at rest.
So that came on all of a sudden, out of the blue, fatigue and all of that stuff picked up.
So then he went back to his cardiologist. They did another angiogram and found those grafts were all occluded. He didn't have good targets. They couldn't do any more surgery. And now his heart was pumping at 30%.
Oh, wow. So he had bypass surgery, 9 to 10 years prior? I was in medical school. They would teach at least the vein grafts would close up after about 8 years. So that's about par for what typically happens. Oftentimes people think when they have bypass surgery, the heart is fixed. I remember being a medical student, we'd say that, oh yeah, he had bypass, his coronary disease is fixed. But it's not fixed. It's really, it may be patched up, but it's not fixed. So one of the bypasses is typically what's called a lima, left internal mammary, which is an artery, and that typically lasts longer, but apparently that was clogged up as well. So from what I'm hearing you say, he followed a heart-healthy diet, exercise, and did all the right things, bypass, etc. But now at the tender age of 60, he's got more symptoms. Coronary angiogram shows all the grafts blocked. He has no more targets. And what does the cardiologist recommend now?
So the cardiologist recommended he get an ICD. Okay. It's an implantable cardio defibrillator, and just continue on a heart-healthy diet, stay on the medications. And he told him to really ease up on the exercise and take it easy. And so it was very disheartening to the patient because he thought he'd been doing everything right. And now he's feeling like, well, what was the point of my surgery back then anyway? It clearly didn't help me or work for me. And so he was really, kind of down about that, I do remember. And so he was here seeking out another solution.
One thing I want to mention, you brought the point about the recommendation of the defibrillator, and many of you who are looking at this may have family members, or perhaps you yourself, have heart disease, and you may have had your cardiologist recommend that you undergo an implantation of a defibrillator, implanted cardioverter defibrillator. As a trained electrophysiologist, over the years, we've understood that individuals with low ejection fractions are at increased risk for what's called sudden cardiac arrest. And there was a well-known trial done, more than a decade ago. We refer to it as SCUT-HEF, but it looked at individuals with a low ejection fraction, pumping function of the heart, that was 35% or below, really below 35%. And they had two groups. They had a large population. They divided into two groups. So one group, they treated them with the standard, heart failure medications, plus an antiarrhythmic drug, amiodarone. And then the other group, they treated standard heart failure medications. They received a defibrillator implant. And they followed the two groups over time and compared their overall survival benefit and found that the group that had the defibrillator implant had approximately 27% survival advantage over the group that did not. These were people who did not have any symptoms, they just had a weak heart. So that then influenced the standard of care in cardiology, where individuals with a heart pumping function less than 35%. And if they're not able to reverse it, that's the other thing. If with medications or whatever treatment you get, cannot get it above 35%, then the recommendation is defibrillator. So apparently, they must have optimized his meds, did what they could do, and said, look, you already had bypass, so we can't do more bypass or stents. You're on the best medications, and your heart's been weak for a certain period of time, get the defibrillator. Of course, as you said, he was a little bit disgruntled with surgery, so he came to see us. I just want to make sure everybody understands that context. That could be informative for you if you're recommended. And I've implanted thousands of defibrillators, and the procedure itself is not a complex procedure. It's very straightforward, it's very well tolerated. I've had patients come and see me, where one gentleman come to mind, and I implanted his defibrillator on a weekend because he couldn't miss work. So we checked him in the hospital, after hours on a Friday. I implanted the defibrillator on a Saturday, discharged him Sunday morning. He went back to work Monday. I had another young lady, she had a condition called long QT syndrome. Very young, she was gonna get married. She needed a defibrillator implant, so I implanted a defibrillator before she went off to get married. She wanted me to make the scar so it fit underneath her wedding dress. So I had to bring a wedding dress to the hospital, so I had to put it up against, and I had to determine how I was gonna make the scar. So I had to make the scar fit on the wedding. I'm just giving you that to just let you know the defibrillator implants go, it's a procedure that's well tolerated and it's effective. And I'm not trying to sell defibrillator implants to the audience, I'm just trying to put the context. So it wasn't an unreasonable recommendation given the context. However, I think there was something better.
So he did the nutritional detox. He did 3 months of the raw meal plan. And he did the infrared sauna, which helps improve circulation. He did the ECP therapy, so enhanced external counterpulsation therapy, which kind of amplifies your body's ability for natural angiogenesis and make collateral flow. It's been shown to improve symptoms in patients with his presentation. So he also did start actually working out pretty intensely. And in 1 month, that very severe symptom of that tightness and pulling on the neck was gone.
Wow. So within a month of this intervention, those symptoms were gone. He's back exercising.
I mean, he was feeling great. We stopped a lot of, I think all of his blood pressure medications because he didn't need them anymore. His ejection fraction actually at that 3-month point had gone up to 40%. And so now we technically didn't meet that criteria to get the ICD. He was just extremely exuberant and happy when he got that news. I was really proud of him because he was so committed and put in so much hard work. Like, he followed everything really to the T, and he took this whole process as like a health gain. Like, he was like, now I have control over my own life, and that actually motivated him and excited him. He was excited about what he was doing now.
I like that comment you made. One thing we try to help our patients do is to gain control, to empower them. And, he knew what to do and how to do it. I mean, the power of the nutritional intervention isn't so much that it's effective, which is, powerful enough. But it's something that once you gain control over how you nourish the body, and it becomes a natural way of nourishing your body, then it really empowers you to really take care of your body. In addition to the exercise that he was very familiar with, again, and then of course avoiding the need for a defibrillator. Again, went beyond the script of needing a defibrillator. ECP therapy, can you explain to the audience what that is and how that works?
Yeah, so ECP is enhanced external counterpulsation therapy. So it's a therapy that helps improve circulation in sync with the heart's pumping and filling. So it increases blood flow to the heart during diastole, and that helps improve collateral circulation, reduce symptoms of angina. We see it really help get ejection fractions up. We see it help improve people's endurance. It's 35 treatments that you do, one a day, Monday through Friday, so it takes about 7 weeks. I think that helped him also get back into more intense workouts too.
Now, ECP is very powerful. It's a great adjunct to the other things you're doing, and it also allows the body to improve nitric oxide production in addition to infrared sauna, and then of course the nutrition, obviously, which is very, very important. And the nutrition, again, I can't say too much about it, but the optimal nutritional regimen as we prescribe it is not a diet, it's an intervention. And it totally removes all forms of food that triggers inflammation and oxidative stress. And that's important when you're trying to heal the body, plus adding time-restricted eating. So that's a very powerful intervention. You're adding with these other interventions, it makes a major impact in terms of, patients being able to improve their health in a really short period of time. And, the whole issue with this whole rope-like sensation, it's a metaphor of him having a noose around his neck. I mean, it's like it's a strangulation. And you can think of these chronic illnesses as strangulating patients. And here was a situation where he was being strangulated by his heart disease, sort of figuratively and to some extent literally in terms of the symptoms. When it came on almost all of a sudden, like a thief in the night, and that's what chronic illness does. And so 1 minute you're fine, you're working out, you're eating a heart-healthy diet, and everything's going great, and then all of a sudden it comes and grabs you by the neck, and that's what happened here. So this is amazing, and I think that it's a lesson to be learned that we have a lot of tools in medicine, but I would say, and again, I wasn't there, so I can't say, okay, should he have avoided surgery or not, but let's say hypothetically, surgery was a necessary thing to do at the time. Let's just give him the benefit of the doubt. What I would say is that after surgery, he wasn't given the best advice, because the so-called heart-healthy diet, I don't know what that means. I know what lots of people eat on a heart-healthy diet. Those things are not heart-healthy. Exercise is important, but he should have been given the right tools then. Once you've had to have your major procedure, whether it's a stent or bypass surgery or something like that, you need to be given the aggressive tools to become very aggressive to maintain your health, and he wasn't given that. So whether you want to criticize the bypass surgery or not, I'm not going to do that, but what I will say is that he wasn't given the adequate tools to maintain the lack of symptoms and also to improve his heart condition. And so hopefully moving forward, we can maintain this and have him have a much better quality of life. So any other comments?
Well, one thing is really he's inspired his family to be healthier, and I'll see him talking to other patients in the kitchen or the hallway. So everyone has the potential to also influence others in a positive way, and he's already really doing that. So
he's become a prophet, says, spreading the word. Well, there you have it. Another, interesting case presentation. And I hope you all have learned from this as much as I've learned from this. I rarely have a patient that doesn't come, who doesn't teach me at least one thing. Most of the time they teach me a lot of things. And so, again, another case of how a motivated patient can really, take control of chronic illness. So anyway, thank you very much for watching. Again, as always, if you have any questions about anything we said or comments, please leave them in the chat. We'll work very hard to respond to those and get your questions answered. Until next time, take care.